Hello, I'm Miranda Gumtow, and I'm a physical therapist at Maple City Physical Therapy. I also do school-based physical therapy for Genesee Valley Central School. Physical therapists can work in a variety of different settings, including outpatient, inpatient, acute care, and school-based. Today, I'm just going to go through and talk about a school-based setting, what the evaluation looks like, kind of what treatment looks like, and the purpose of school-based physical therapy. So this is just pretty much what I'm going to talk about. So what is school-based physical therapy? Some of the service descriptions, the screening process, the evaluation process, and some treatment ideas. So physical therapy as a practice, physical therapists help injured or ill people improve movement and manage pain. They are often an important part of preventative care, rehabilitation, and treatment for patients with chronic conditions, illnesses, or injuries. So that's typical in a school-based, or not school-based, in an outpatient, inpatient, or an acute care setting. However, in a school-based setting, a physical therapist is a member of the provider team that helps to support a student's abilities in the school environment specifically. So school-based physical therapists don't technically or normally treat athletes or anything like that are injured. We see children with like developmental disabilities, gross motor delays, those sorts of things to help them interact better with their environment in the school. Physical therapist focuses on gross motor movements and the larger muscles of the body. So in a school-based setting, we assist in improving a student's physical participation and safety. So this is the screening process. So the purpose of a physical therapy screen is to determine if a full evaluation is needed. So a request for one of these screens can be given by a parent, a teacher, or another provider if there is a concern about gross motor development. A physical therapy screen consists of an observation of general gross motor skills that should be developed based on the student's age. So below are just some examples listed of kind of what I look at when I'm just doing a general screen. So if there are deficits seen during the screening process that are a concern to a student's school-based participation, a full evaluation is recommended. Once parent consent is signed and a script from the MD are signed, the evaluation process will begin. So the purpose of a physical therapy evaluation is to compare a student's gross motor skills to their peers based on a variety of different subtests. So the subtest that I use is the evaluation tool I use is the BOT2. Those are the four areas that I look at: bilateral coordination, balance, running speed and agility, and strength. So the BOT is a norm reference evaluation tool designed to assess the motor ability of a child from ages 4 to 21. Running speed and agility is assessed with a brief high-speed shuttle run test. Balance is assessed through different activities requiring a student to maintain their equilibrium or their balance when they're stationary or moving. Bilateral coordination involves the ability to coordinate the hands and feet simultaneously, such as jumping jacks and those sorts of things. And then strength is assessed through the student's ability to perform tasks requiring the use of arm, leg, and abdominal muscles. So each subtest is given a raw score based on how they perform each activity in that subtest, and then that score is used to determine scale and standard scores. The scale and standard scores are then used to determine three different descriptive types that interpret the child's motor function. So percentile rank is used for determining where the child's score falls in relation to the same aged peers. So an example would be if a student scored 37 and they were in the 10th percentile, that means that only 10% of children in their age group scored lower than that score. An age equivalent is also given, which represents the developmental age of their motor performance. And then a descriptive category is also determined where the examinee falls in relation to the norm sample. So below average, above average, well below average. So following the evaluation process, a meeting is held with the CSE committee to see if the student qualifies for services. So if a student does qualify for services, we provide treatment ideas based on the deficits that were seen during their evaluation and that go along with the goals that were given. So a child does not need to have a disability in order to qualify for school-based physical therapy services. Physical therapy treatment can be recommended and given for any deficit that affects a student in the school-based setting. So common deficits that I see when I do an evaluation or a screen on a new kid are balance difficulties, which increases their fall risk, decreased body awareness, which leads to impulsivity and safety concerns, difficulty with stairs, decreased core strength, which affects prolonged sitting at their desk, difficulty with ball skills, which can affect interactive gameplay with their peers. So a couple of treatment ideas if I have a kiddo that just has trouble with balance, we do plank catch, standing on one foot on even, uneven surfaces, just to kind of improve that balance. Kiddos with body awareness problems where they have that impulsivity, just want to flop on the floor. We do freeze game obstacle courses used to focus on slowing movements to improve body control. Stair negotiation, using colored footprints on the stairs to promote a reciprocal or step over step pattern. And core strengthening, being on their tummy on a TheraBall or a scooter, completing a puzzle, anything like that will help improve the muscles needed for that prolonged sitting. So goal monitoring and progress. So based on the deficits that are seen during testing, goals are developed to be monitored throughout the school year to measure students' progress. Progress notes are sent home along with report cards on how the child is doing and progressing towards their goal in therapy.